When my wife, Miranda, and I decided to move to Greenwood Glade, we were seeking a peaceful suburban haven after years of frenetic city life. Greenwood Glade was a picturesque neighborhood with tree-lined streets, modestly luxurious houses, and a glistening central pond where ducks paddled lazily. It felt like the perfect escape from the pressures of my job, pressures that most neighbors wouldn't even realize I carried. As Director of State Public Health, I was deeply involved in planning and coordinating important health initiatives, vaccination campaigns, regional epidemiological studies, emergency response strategies, and more. I was thankful for a chance to find some tranquility away from the hustle of state bureaucracy. We arrived one crisp spring day, welcomed by the mild weather and bright sunshine. Moving trucks came and went, depositing our furniture, boxes of clothes, and my office essentials. Despite my high-level position, I always tried to maintain a low profile at home. In Greenwood Glade, I planned to keep my job details under wraps. After all, I wanted to be seen first and foremost as a friendly neighbor, not the big boss from the state capitol. But from the start, I discovered there was one person whose involvement in Greenwood Glade overshadowed everything. The president of the Homeowners Association, Margaret Arnwell. From a distance, she looked every bit the perfect suburban matriarch, immaculate bob haircut, pastel sweaters, polite smiles. Yet there was a quiet intensity in her gaze that suggested she was always measuring people, always calculating how they fit into her personal vision of Greenwood Glade. That very first week, she welcomed us with a professionally printed brochure titled Greenwood Glade, Rules and Regulations. "I'm delighted you've joined our community," she said in a crisp tone, handing me the thick booklet. "We have high standards here. We expect all residents to follow the guidelines that keep this neighborhood safe, orderly, and beautiful." "Thank you, Ms. Arnwell," I replied, sensing a certain edge beneath her politeness. "We'll do our best to respect the rules." She inclined her head. "I'll keep in touch to ensure your transition goes smoothly. Have a wonderful day." Then, with a fixed smile, she strode off, leaving a faint whiff of expensive perfume in her wake. I shrugged it off. A strict HOA was nothing new. I'd grown up hearing stories of suburban boards that micromanaged the height of mailboxes and the color palette of front doors. Yet something about Margaret's demeanor put me on guard. Over the next few weeks, Miranda and I settled in. We repainted a few interior rooms and landscaped the backyard for our 2 dogs to enjoy. We met neighbors while walking the dogs at dusk, pleasant folks with normal suburban lives. We'd exchange small talk, wave across fences, or help each other carry groceries. It seemed idyllic. If Margaret occasionally floated by on her HOA inspection rounds, we chalked it up to harmless routine. I didn't yet realize that Margaret's controlling instincts extended beyond superficial lawn rules and would soon intersect with a critical public health initiative that I was quietly planning to introduce. Little did I know how fiercely she would fight to exert her authority, even at the risk of endangering people's health. As Director of State Public Health, I oversaw a variety of programs aimed at keeping communities safe and healthy. One of our newer initiatives involved partnering with local neighborhoods to offer periodic free blood testing services. These tests checked for cholesterol levels, blood sugar, and potential indications of chronic conditions like diabetes, kidney disease, and more. We also screened for certain pathogens, crucial to preventing localized outbreaks if we detected them early. We called the program Health on the Block, or HOB. My team developed a strategy. We'd deploy mobile medical vans to different neighborhoods, set up for a week at a time, and allow residents easy, no-cost testing. We'd done small pilots in a few cities, with encouraging results. People loved the convenience of screening close to home. Doctors caught warning signs earlier, and health outcomes improved. It was a win-win. Now we aim to expand HOB across the state, including suburban areas like Greenwood Glade. On the surface, it sounded like an easy sell. Why wouldn't a community want free screenings for residents, especially for older adults or those with limited transport? But local cooperation was critical. We needed to coordinate with community centers, town halls, or HOAs for parking and logistics support. I decided to float the idea in Greenwood Glade. The HOA had enough communal facilities, a clubhouse, meeting room, and a large parking lot that could host the mobile testing van for a short time. My plan: quietly propose the program at the next HOA meeting, see if folks like the idea, and if so, schedule a pilot. I kept my Director of State Public Health role under the radar, introducing myself simply as a public health official who knew the program was looking for volunteer neighborhoods. I thought the initiative would benefit Greenwood Glade. Initially, a few neighbors I mentioned it to were excited. "We have lots of retirees here," said Mr. Linden, an older gentleman who walked his terrier along my street daily. "They'd appreciate easy access to tests. My wife's mobility is limited. She'd love to have the van come here." I smiled, heartened by his encouragement. That's exactly the goal. Bring screenings closer to home, catch health issues early. But others warned me that any plan needing HOA approval could be an uphill battle if Margaret disapproved. "She's rather, controlling," one neighbor said gingerly. "If it's not her idea, she might not let it happen." I shrugged. "Once she sees the benefits, I'm sure she'll support it." At the time, I believed rational argument and the promise of improved community health would sway her. I had no clue how misguided that hope was. The monthly HOA board meeting was held in the Greenwood Glade Clubhouse, a pleasant building with large windows overlooking a pond. Rows of metal folding chairs faced a long table where Margaret and several board members sat, all wearing matching name badges. About 30 residents attended that evening, which I soon learned was considered a good turnout. I arrived early, took a seat near the middle, and quietly observed. The meeting began with housekeeping matters, budgets, landscaping updates, finalizing a rule about holiday decorations. Margaret presided with the poise of a seasoned ruler, her voice crisp, each agenda item passing with minimal debate. When it came time for open proposals, I raised my hand. "Yes, Mr." Margaret glanced at her roster. "Mr. Adams, correct?" I stood. "Yes, thank you. I wanted to propose something called Health on the Block, HOB for short. It's a statewide pilot program offering free blood testing and basic health screenings to local communities. I'm involved in public health, and I think Greenwood Glade could really benefit." A few neighbors perked up. Some nodded encouragingly. I outlined how the mobile clinic would park in the clubhouse lot for a few days, letting residents drop by for quick tests, cholesterol, glucose, blood pressure checks, possible pathogen screenings if needed. It was entirely voluntary and cost-free. Margaret listened without expression. Several board members seemed intrigued, especially once I mentioned that the state would handle logistics and expenses. No cost to the HOA, just the use of the parking area and clubhouse restrooms. "This sounds beneficial," said a board member named Denise. "We have an older population, and even younger families might appreciate convenient screenings." I saw glimmers of excitement in the audience. Then, Margaret cleared her throat. "Thank you, Mr. Adams, for your passion. However, we must consider several factors. First, the disruption to the clubhouse schedule. Residents often reserve it for gatherings. Second, the liability. If anything goes wrong with these medical procedures, might the HOA be at risk? Third, traffic and parking. People coming from outside Greenwood Glade might crowd our spaces. I'd prepared for such concerns. Great points. We can structure the clinic so it's only open to our residents, plus maybe direct neighbors. And it won't take more than a few parking slots. Liability is handled by the state's insurance. We can even provide documentation. I'm happy to work with you on scheduling so it doesn't conflict with other events." Margaret's face remained stony. She thanked me for my presentation, then suggested the board deliberate further. She didn't call for a vote that night. Meeting adjourned. Some neighbors approached me to say they hoped the program would happen. But Margaret left swiftly, ignoring my parting wave. My gut twinged with unease. She was polite on the surface, but I sensed her reluctance. Usually, when I pitched HOB to local groups, their leaders responded enthusiastically. Here, the mood felt chilly. Still, the rest of the board seemed open-minded, so I waited, optimistic that reason would triumph over Margaret's caution. Over the next week, I sensed a campaign brewing beneath the surface, one aimed at squashing the blood testing initiative. Margaret started circulating a memo titled Potential Concerns Regarding Medical Testing on HOA Property, listing risks such as contamination, insurance liabilities, data privacy issues, and non-resident intrusion. The memo was peppered with vague references, unverified claims, and rumor-like statements. A neighbor once had a bad experience with on-site medical services. Imagine if the blood draws lead to unsanitary conditions. Will we face financial ruin if someone faints or gets infected? The entire list read like fear-mongering. Copies appeared in mailboxes, pinned on the clubhouse board. When curious neighbors asked me about it, I explained that HOB followed rigorous sanitary protocols. Our staff were licensed medical professionals. We carried comprehensive insurance. There was no risk of random strangers overrunning Greenwood Glade. But Margaret's glossy memo had unnerved many. Meanwhile, a few open-minded board members tried to quell the panic. Denise, the member who'd initially seemed supportive, told me privately, "I'm sorry about this. Margaret can be unrelenting. She wants absolute control over everything that happens here. If it's not her idea, she tries to bury it with red tape." I asked, "But the board can outvote her, right?" Denise sighed. "In theory, yes. But she's savvy. She'll pressure others behind the scenes, spread rumors, threaten minor fines, hint that if they don't back her, she'll cause trouble with their landscaping or paint color approvals. It's petty, but people are scared to cross her." A mixture of frustration and disbelief twisted in my stomach. For years, I'd navigated state-level politics, negotiating with city councils, county commissioners, even legislative committees. Somehow, dealing with a single HOA president felt more challenging. Margaret's brand of local tyranny was deeply personal, affecting neighbors' day-to-day lives. She clearly relished this power. Refusing to be cowed, I kept providing facts. I attended another small HOA workshop where I calmly answered questions about infection control, screening benefits, and disclaimers. Several seniors seemed grateful, saying they rarely got to the doctor for routine checks. "This could literally save lives," said Mrs. Kowalski, who worried about her husband's heart condition. Still, Margaret hovered with arms folded, launching pointed questions. "Are you sure the van won't pollute our environment? What about hazardous waste disposal? Do we want Greenwood Glade to become known as a medical testing ground?" My polite replies seemed to bounce off her. At the end of the workshop, she declared, "We'll finalize a decision at next month's meeting," then swept out. People mumbled in frustration, but none openly challenged her. One afternoon, I was walking our dogs along the tree-lined sidewalk when I saw Margaret across the street, clad in yoga pants and a visor, scrutinizing a neighbor's lawn with a notepad in hand. She spotted me, offered a tight smile, and crossed over. "Mr. Adams," she said, "I trust you're enjoying Greenwood Glade." "Yes," I said, "the neighborhood is lovely. I hope we can finalize details for the Health on the Block program soon. I've got the state ready to schedule us once the HOA board approves." She gave a breezy wave of her hand. "We're still reviewing. But to be frank, I'm not convinced our residents need such a service. Most have their own doctors, and we prefer not to invite unnecessary foot traffic." I tried a reasoned approach. "Plenty of folks here find it difficult to travel for routine blood work. Some might skip these checks altogether. This is about preventive care, catching issues early. If we detect something like a virus or abnormal levels, we can direct them to medical help right away. It's safer for everyone." She pursed her lips. I'm just concerned about liability and the potential disruptions. Also, certain neighbors told me they feel uncomfortable with strangers performing blood draws in the clubhouse." I suppressed a sigh. "Margaret, the staff would be certified phlebotomists. We do everything by the book. If you have any doubts, I can show you the state's guidelines, the insurance coverage, anything." Instead of answering, she gave me a thin-lipped smile. "I appreciate your enthusiasm, Mr. Adams. Let's see how the board decides." Then, her expression shifted to a mild sneer. "But do keep in mind, I know every rule in this HOA. Should your own property slip in any way, unapproved modifications, pet infractions, I will notice." Was that a threat? My gut told me yes. I realized this was no normal neighborly disagreement. Margaret was effectively telling me, "Back off, or I'll make your life miserable." The moment's tension was palpable. I forced a polite nod and walked away. Inside, my anger simmered. Who did she think she was, threatening me with trivial HOA violations to block a vital health initiative? It was absurd. Yet I recognized how she operated. Fear, intimidation, gossip. Perhaps I should just reveal my full position, Director of State Public Health, and let the weight of my role crush her opposition. But I hesitated. I wanted the neighborhood's genuine buy-in, not compliance out of intimidation. Also, I disliked using my rank as a cudgel. But part of me started to wonder if that was exactly what Margaret deserved. As the weeks passed, the rest of the HOA board wavered. Some members told me quietly they wanted to greenlight the blood testing. However, Margaret kept stalling, claiming she needed more investigations into unspecified risks. Meanwhile, the state team grew impatient, needing a schedule to deploy. Other neighborhoods were already signing up. Greenwood Glade might lose its chance if we didn't confirm soon. Then came a blow I never saw coming. At the next monthly meeting, my proposal on the agenda, Margaret announced that the HOA had decided not to allow health on the block on its premises. She breezed through a prepared statement. After careful consideration, we find that the potential liability, logistical burdens, and community discomfort outweigh the benefits. We must keep Greenwood Glade free from unnecessary disruptions. The board has unanimously agreed to deny the request. I blinked in shock. Unanimously? That conflicted with what some board members had hinted to me. But in the meeting, not a single person raised an objection. They all sat quietly, eyes down, as Margaret delivered the final verdict. It was a done deal. After the meeting, I cornered Denise. Why didn't you speak up? You seemed supportive. Her face was tight with anxiety. I'm sorry, Mark. Margaret threatened to fine me for minor violations around my property, like the color of my shutters. She told me if I voted in favor, she'd fight me tooth and nail. She's done the same with others. They're frightened. She's turned this into a power struggle. I felt rage coil in my gut. The very service that could save neighbors' lives was being blocked by petty intimidation. And apparently, she'd orchestrated a show of unanimous support by bullying her own board members. Meanwhile, some residents, particularly seniors, had quietly approached me, disappointed the service wasn't coming. At home, Miranda found me brooding. You look upset, she remarked softly. I explained. She unilaterally shut down the program. I can't accept that. People need these screenings. Miranda placed a hand on my shoulder. You have the authority to override her, don't you? At the state level? I do, but it's typically not done. HOAs have local jurisdiction. We can't force them to host the clinic, unless there's an emergency declaration. But that rarely applies to routine screenings. My mind churned, thinking of ways around the block. Miranda squeezed my hand. Whatever you decide, I'm with you. But maybe it's time you show your real influence. This is about people's health, right? I nodded slowly. Maybe so. If Margaret wanted a power game, I could bring in powers far beyond her HOA. But I still wished for a peaceful resolution. As a public health official, I valued collaboration. Yet it seemed Margaret only understood confrontation. Shortly after Margaret's so-called unanimous rejection, a subtle but alarming health concern arose. A nearby county reported a slight uptick in unusual flu-like symptoms. A few cases tested positive for a rare strain of virus that, while not typically deadly, could become severe in vulnerable individuals if not caught early. Our state's epidemiologists flagged it, recommending increased vigilance, particularly in communities with older populations. I saw the initial data cross my desk. My concern spiked. If that virus spread undetected in Greenwood Glade, especially among seniors, it could lead to complications. Timely testing would be crucial to identify carriers and slow transmission. The HOB blood screenings could be expanded to test for that virus, too, if we set up in time. This was exactly the scenario the program was designed to handle. Early detection, quick guidance, preventing small outbreaks from becoming big ones. I brought it up at my next internal briefing. We need proactive screening in that region. We have the mobile units. Let's prioritize neighborhoods with older demographics. My staff quickly lined up 3 possible sites, none in Greenwood Glade, thanks to the HOA's block. But Greenwood Glade was precisely the demographic that could benefit most. My frustration with Margaret doubled. Nevertheless, I tried to remain a professional. We were not at the stage of an official emergency, so forcibly overriding local HOA rules would be a major overstep. Instead, I tried another angle. I asked if Greenwood Glade's community center, which wasn't strictly under HOA control but was partly funded by them, could serve as an alternative. But Margaret had that locked down, too. She basically controlled the booking system, and she refused to give me a slot. She cited prior engagements and maintenance as excuses. I suspected it was her revenge for persisting. At the same time, rumors spread that some Greenwood Glade residents were showing odd, persistent coughs. A few saw their doctors, who recommended further tests. The local clinic was overwhelmed. One nurse confided in me. We're seeing more seniors from your subdivision with borderline viral symptoms. We can handle them, but if the number grows, we might need a dedicated testing site. I felt torn. The perfect solution, on-site screening, was blocked. Meanwhile, I learned Margaret had circulated new flyers stoking fear about medical meddling. She labeled me a meddlesome neighbor trying to turn Greenwood Glade into a free clinic. She claimed the community was better off trusting private doctors. The partial truth: if people had easy, affordable private doctors, that was fine, but many didn't or rarely visited them for routine checks. Now, with a possible virus in the mix, ignoring basic screening was downright risky. Sensing the potential hazard, I appealed to the local town council, explaining how Greenwood Glades HOA was blocking a beneficial public health measure. The council's general stance was that HOAs are private entities, free to decide how to use their resources. They sympathized but had limited leverage unless an official outbreak or declared emergency forced a different approach. The virus cases edged upward. We still lacked conclusive evidence of a severe outbreak, but the risk was growing. Meanwhile, I quietly arranged for an alternate screening site at a church just outside Greenwood Glades boundaries. Any local resident could go there, but it wasn't as convenient, and I worried that many older folks wouldn't make the trip. One morning, I found an official letter taped to my door, an HOA violation notice for excessive backyard foliage. The letter threatened a $200 fine if I didn't prune some bushes to meet the 6-inch window clearance rule. I recognized it as the petty intimidation Margaret had promised. Fine. I trimmed the bushes, paid the fee grudgingly, and set my jaw. If she was trying to push me into leaving or giving up, she'd have to try harder. At the next HOA meeting, I didn't even bother bringing up the health program. Instead, I listened to Margaret brag about how Greenwood Glade had successfully maintained its pristine environment by rejecting disruptive proposals. She singled me out by name. Though we admire Mr. Adams' zeal, we concluded that on-site blood testing was not in our best interests. Our board stands by that decision. Her supporters clapped. Then, ironically, a handful of seniors asked if the HOA might organize group transport to the church site for testing. Margaret frowned, hemmed and hawed, eventually said, "Well, we'll look into it." But I doubted she would. After the meeting, I overheard her whisper to a subordinate, "I don't want that fiasco revived. If they want tests, they can figure it out themselves." She breezed out, leaving me seething. The worst part was, Margaret still had no idea I was the state's director of public health. She assumed I was just a low-level official pushing a single project. If she knew my real role, well, perhaps it wouldn't change her stance, but it might curb her arrogance. I still hesitated, disliking the idea of throwing my title around. But as the viral threat loomed, I wondered if there'd come a point where revealing my authority might be the only way to protect this community from her own short-sightedness. Days later, a more alarming development rocked the region. Several confirmed cases of that rare virus turned severe in a neighboring county's nursing facility. A few patients were hospitalized, one in critical condition. That triggered immediate escalation in our state health protocols. My office began drafting a public health advisory, urging residents to get tested if they showed any symptoms: cough, fever, fatigue. We weighed whether to declare a partial health emergency, which would open up certain legal channels for mandatory testing, or quarantine. However, the epidemiologists recommended we gather more data first. If the virus spread further, a formal emergency might become inevitable. I read the latest briefs with mounting worry. Greenwood Glade, with many seniors, was a prime spot for an outbreak if a single infected person roamed about undiagnosed. Our free screening could be vital in identifying carriers. Yet Margaret's blockade remained firm. Finally, I called an emergency meeting of my top staff. "We can't ignore Greenwood Glade," I said. "There's a real possibility of undetected infections there." One advisor suggested we set up a pop-up clinic right outside the gates, on a public street. "They can't stop us if it's not on HOA land," she reasoned. That was possible, but it would still hamper accessibility. I had another angle. If we discovered even a single suspected case inside Greenwood Glade, the state could require on-site testing under the Infectious Disease Control Act. But we needed evidence. At that moment, the suspicion of multiple sick seniors was rumor, not an official record. The local doctors' offices were overburdened, and we hadn't compiled enough data to confirm a cluster in Greenwood Glade. Time was ticking. I dreaded a scenario where the virus spread to a dozen or more seniors, leading to hospitalizations, or worse. The friction in me built, a moral imperative to protect them from Margaret's reckless stance. I can't let her ego overshadow public health. One evening, after a particularly stressful day at the office, I arrived home to find Miranda upset. Susan from 2 doors down came by, she said. Her father's been feeling weak and feverish for days, but he refuses to see a doctor. He hates waiting rooms. She'd heard about your testing vans and asked if Greenwood Glade would get one. I told her not currently, because of Margaret's ban. She was so upset. She said her dad probably won't bother traveling to the church site either. That conversation weighed on me. This was exactly the scenario I dreaded. Older residents not seeking timely care. If he had that virus, he could spread it to others or worsen himself. And we had a feasible solution that Margaret had torpedoed. The next day, I tried calling Susan to encourage her to take her father to the church clinic or any local urgent care. She appreciated my concern but admitted her father was stubborn. If it was in the clubhouse, he'd go. But now he says it's too much hassle. My frustration with Margaret hit a boiling point. That same afternoon, I spotted her in a small green belt behind my house, overseeing the trimming of shrubs. I marched out to speak with her, not even sure what I'd say, but my emotions were high. Margaret, I greeted tersely. She turned, looking mildly irritated. Yes, Mr. Adams? Is there an issue with your shrubs now? I took a breath, struggling to remain composed. We have potential virus cases among seniors here. People who need easy, on-site tests. The state can set it up for free. Why won't you let them? She scoffed. We've been through this. It's not the HOA's job to host medical endeavors. If people are ill, they can drive to their doctor. Simple. No, it's not so simple, I countered. We have seniors who can't or won't travel. You're jeopardizing their health. Possibly others, too. Her eyes narrowed. That's their choice. Greenwood Glade has the right to remain free of your big government intrusion. The board has decided. End of story. I took a step forward, voice trembling with anger. You do realize how irresponsible this is, especially if there's a contagious virus spreading? Lives could be at risk. Don't exaggerate, she retorted, crossing her arms. You're just trying to push your agenda. I've told you, the answer is no. We glared at each other. Adrenaline coursed through me. A part of me wanted to brandish my official status, telling her that she'd face severe consequences for blocking a vital health measure. But I held back. She turned on her heel, striding away with that haughty posture. Left standing under the hot sun, I realized my patience had run out. If an outbreak erupted, I couldn't simply let her hold Greenwood Glade hostage. My job was to protect public health, and I had the authority to do so. She wants war? Fine. Let's see how she fares when the full weight of the state's public health apparatus comes crashing down. Within days, the situation escalated dramatically. Reports indicated a sudden spike of severe cases in the region. The virus, once considered a minor threat, mutated or spread faster than expected. My staff recommended immediate action. We convened an emergency state health council session and, based on rising hospital admissions, declared a localized health emergency across multiple neighborhoods with vulnerable populations, including Greenwood Glade. An official directive followed. Public health workers had the authority to conduct on-site screenings in any facility suitable for large-scale testing. HOAs could not legally interfere with these emergency measures. If they tried, they risked criminal penalties. Typically, we tried to collaborate, but if a local entity refused, we could override them for the public good. The next morning, I personally led a team of state health personnel to Greenwood Glade, accompanied by 2 vans full of medical equipment, testing kits, and signage. I also brought a small contingent of local law enforcement officers, who were there to ensure compliance with the emergency order. As we rolled in, curious residents peered from windows. Some approached, relieved to see the testing had finally come. We parked in the clubhouse lot. No question about needing permission. Our officers taped up official notices. Emergency public health testing in progress. All residents encouraged to participate. The medical staff began setting up stations. Word spread rapidly. Within an hour, a line of seniors had formed, many wearing masks or coughing lightly. That's when Margaret arrived, storming out of her house. She marched across the lot, fuming. "What is this?" she demanded, eyes blazing. "You can't just barge in here with your vans." I didn't grant permission. I stepped forward, wearing my official public health ID badge around my neck, one that clearly read Director of State Public Health. She blinked, momentarily taken aback. "Margaret," I said calmly, "we have declared a local health emergency. State law authorizes us to set up mandatory or voluntary testing in any suitable community venue. I'm in charge of this operation." She stared at my badge, speechless. Realization dawned that I wasn't just some mid-level coordinator. I was the top official. You lied," she sputtered. "You never told me you were a big-shot bureaucrat." "My role has been the same from day one," I replied. "I offered Greenwood Glade the chance for free blood testing. You refused. Now we're compelled to use emergency powers because the virus is spreading. Our neighbors need immediate screening." Red-faced, Margaret pointed a trembling finger. "You have no right to do this. This is private property. I'll call the police." One of the uniformed officers on our team stepped forward. "Ma'am, the police are already here, and we're cooperating with the State Public Health Department under the emergency declaration. If you interfere, you may face criminal obstruction charges." I saw the flicker of fear cross her face. She tried to maintain her composure, but was clearly rattled. "How dare you threaten me? I'm the president of this HOA. I decide what happens here. Not during a public health emergency," I replied firmly. "Now, unless you'd like to be arrested, you'll let our medical staff do their work." I turned away, walking calmly to greet a line of elderly residents who looked relieved to see us. Margaret stood there, hands balled into fists. Then she stormed off, shrieking, "You'll regret this," in a last-ditch attempt at intimidation. But no one paid her any mind. The testing proceeded, neighbors grateful to finally access these services. For once, Margaret's power crumbled under the reality of a larger public mandate. The testing went on for several days. We identified multiple positive cases of the virus in Greenwood Glade, mostly mild, but a few required hospital care. By catching them early, we likely prevented more widespread infection. That alone justified the emergency operation. Most residents thanked us profusely, shaken by how close they'd come to an uncontained outbreak. Margaret, meanwhile, hurled complaints and threats. She tried petitioning the county council, threatening lawsuits. But the law was on our side. She might have stymied the initiative before, but once an official emergency was declared, her HOA authority was meaningless against the state's mandate. She'd lost that battle. Yet it didn't end there. Investigations revealed that, over the past month, Margaret had deliberately suppressed medical warnings from the local clinic. She'd apparently refused to forward important flyers about virus precautions, telling the clinic staff that the HOA didn't want to alarm people unnecessarily. Some suspected she also tried to intimidate seniors into not reporting their symptoms to avoid tarnishing the neighborhood's reputation. By blocking timely information, she had endangered her own community. Once that came to light, a wave of outrage swept through Greenwood Glade. Several families filed formal complaints. The Department of Public Health looked into whether her interference violated public health codes. Meanwhile, some residents dug deeper into her HOA finances. They discovered questionable spending. She had used HOA funds for personal expenses, concealed by fake landscaping invoices. The board members, once cowed by her, broke ranks. They turned over evidence to local authorities. Eventually, the county prosecutor filed charges, obstruction of a public health measure and misappropriation of HOA funds, among others. In a sensational twist, she was also sued by multiple neighbors whose relatives fell ill. The civil suits alleged that her denial of on-site screenings contributed to their loved ones' hospitalizations. Margaret found herself facing a barrage of legal trouble, her tidy, suburban empire crumbling. At the preliminary hearing, she tried to maintain her haughty demeanor. But the judge was unsympathetic, emphasizing how her decisions had put lives at risk. Denied bail on some charges due to flight risk concerns, Margaret was led away in handcuffs, a humiliating end to her reign as HOA president. Her property faced liens from mounting legal debts and civil penalties. Real estate lawyers predicted she'd likely lose her house to pay the judgments. When the dust settled, Greenwood Glade breathed a collective sigh of relief. A new interim board took over, pledging transparency and respect for residents' well-being. The blood testing program continued its work, eventually broadening to other nearby HOAs once word spread of its success. The virus outbreak stabilized, thanks to timely detection and quarantines. Months later, Greenwood Glade looked and felt different. While the lawns remained immaculate, the atmosphere was more relaxed without Margaret's constant scrutiny. Neighbors chatted openly about health, grateful for the screenings that likely prevented a worse crisis. The HOA board formally apologized for blocking the initiative, explaining how Margaret had manipulated them with threats and misinformation. Many senior residents expressed relief they could finally get medical attention without stigma. Some of them wrote heartfelt letters thanking the state health team for intervening. Miranda and I remained in Greenwood Glade. We still enjoyed the quiet streets, the pond reflecting pink-hued sunsets, and friendly faces on morning dog walks. My cover was fully blown, of course. Everyone now knew I was the director of state public health. But that was no longer a problem. Folks realized I'd genuinely tried to help from the start. Where Margaret had sought control, I'd offered compassion and solutions. The difference was stark. As for Margaret, forever known behind closed doors as Karen, she languished under legal proceedings. Plea bargains fell through, and eventually, a judge handed down a prison sentence for her obstruction and financial misdeeds. Her property was confiscated to satisfy restitution orders. Greenwood Glade would never see her trifling HOA memos again. Looking back on it all, I realized how one person's arrogance and paranoia could jeopardize an entire community, especially in matters of public health. Yet also, how a well-coordinated, decisive response, grounded in science and guided by the law, could save lives and restore sanity. Greenwood Glade emerged stronger, a testament to the resilience of ordinary people united for the common good. And me? I stayed mindful that, in the future, some local tyrant might again stand in the way of critical public health initiatives. But this experience taught me that I can, and should, wield my authority when necessary to protect vulnerable populations. In times of crisis, ensuring people's well-being is not just a political talking point. It's a moral imperative. With Margaret gone, Greenwood Glade's biggest hazard had vanished, replaced by a sense of shared purpose. The community was at peace, and I was grateful. Sometimes, driving home, I'd see neighbors waving as I passed, or a group of seniors strolling by the pond, and I knew that, in our small suburban corner, health and compassion had finally prevailed.